Research recap, domestic violence related to crisis, trauma, and loss. So this part is going to be the treatment plan for domestic violence, and this is using trauma-informed care. The primary clinical impacts of trauma-informed care is going to be the safety and stabilization, processing the traumatic events, and then reintegrating and reconnecting from the past to now. So obviously those are going to happen over a series of weeks, months, years, and the steps might go back and forth. They're not just linear. They're not simple and going to happen in one session. The client needs are going to be safety, obviously, especially from domestic violence. Physical safety is very important. Psychological safety of feeling like they're safe is very important. Building up themselves emotionally is something that the client needs to understand that they have the power to take back. They have power to maintain boundaries. An effective way of addressing the crisis, trauma, and loss from domestic violence is processing the traumatic behaviors, which is the step number 2 of the primary impacts from the trauma-informed care. So processing the trauma is not only a way of grieving the loss, but also understanding that you are safe now. So 3 main goals for addressing clients' needs are maintaining living environment, set up boundaries and sticking to them, and then number 3 is using social support when needed. So that's a very hard balance to do, of saying, I'm building myself up, I'm going to maintain distance from these people because of my boundaries, but I also need financial and physical support. So am I going to re-victimize myself to be able to have financial support again? So within the next minute, we're going to go over the safety plan. So this is warning signs, how to distract the self, professional agencies, and items to make the environment safe. So some warning signs are going to be those violent incidences that seem to be very isolated. Noticing in yourself, are you making excuses for this person? Are you justifying it in a way, even though people are kind of seeming to say, hey, seems kind of weird? Internal coping strategies are going to seem self-destructive, and you may beat yourself up over it if you were experiencing domestic violence, because they're not going to be healthy. Having somebody that you can ask for help, that you can confide in, that you can talk to, and them be non-judgmental of you, if this is a counselor or a friend, so that way you can contact them when you are in that crisis mode of experiencing the violent incident. Items to make the environment safe is getting away from the perpetrator.